Here at Keystone Periodontics, we offer oral hygiene sessions. Why? These oral hygiene sessions are so important for your treatment here. It's for preventive reasons and to give you the information you need to reach your oral health. So what I normally do is I ask my patients to show me what their brushing looks like at home. So what they normally show me is two different ways, this back and forth motion, and then sometimes this up and downwards motion. While this can be effective, it's not as effective as we would like it to be. So what I would like to show them then is just this specific area, this junction where the gum meets the teeth. And I ask them to place the toothbrush there in that area, so they can see for themselves how the brushing should be done. Because this area is where the plaque does tend to build up and seep into the gum line. Now what we want to do is prevent that from happening. So if we point a toothbrush at a 45 degree angle into this junction and we do these back and forth massage and motions, that should be an effective way to prevent this from happening. Now, 5 seconds on each tooth surface, like we discussed earlier, the four teeth surfaces that we want to brush. So what a demonstration would look like is something like this. So 1, 2, 3, 4, 5. The back of our molar, 1, 2, 3, 4, 5. On to the next tooth, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. When we get to these front teeth, what we call anterior teeth, what I would like is for you to pull your lip down, see what you're doing, and continue doing the 5 seconds. Now, when we get to these occlusal surfaces, where we bite down, it's not as tedious as it is at the gum line, but what we want to emphasize is that during your periodontal treatment, we don't also want you to have a decay problem. It gets quite overwhelming for patients then. So what we recommend is still a 5 second brushing there and into these fissures or these cracks in your teeth. So we give it a good 5 second brush on each tooth and the whole way around then. Now, what we move on to is this lingual surface, because it's quite important. What happens here is that because we have salivary glands, it shoots saliva at the back of our teeth and we tend to get a plaque build up here. So what we do is we change technique ever so slightly to reach these areas better. And what we ask patients is to start at the back of their posterior molar and work our way to these teeth. So what we're doing is what I previously taught, is to point your toothbrush into that gum line, 5 seconds, back and forth motions, 45 degree angle until we reach these teeth. And then I ask them to stick their toothbrush out of their mouth and do these up and down massage and motions, 5 seconds on each tooth surface. And then back to our normal brushing.